Hi, I'm Dr. Jessie at the Healing Collective in Nilowoc, Colorado, and this is a video for my patients who, in the clinic, we've determined this side-lying, passive and functional stretch position will either benefit their scoliosis, their low back pain, or their pelvic asymmetry for their home program. Now, if you have worked with me in the clinic, you know which side goes up and which side goes down and which side to repeat more than the other. If you have questions about this, feel free to reach out to me in a charm message. So if you have a yoga bolster available, that is pretty optimal. Most people tolerate and appreciate a yoga bolster, but not everyone has one, and that's okay. If you have two blankets that we fold in this orientation, those stacked one on top of the other become about the same as a yoga bolster. So you can use either. It's totally fine. And then additionally, depending on how comfortable your neck is going into side bending, you might want a pillow just to prop under your head for this exercise. So you'll get started placing your bolster on the floor or on a firm surface. You'll lay with the affected side down that we talked about in the clinic. And from here, you want to lay such that your armpit is touching the top of the blankets or bolster. So you'll lay over the bolster so that it's impacting your rib cage rather than, if you were up so high, it would be more of the low back. And so for most of these, we'll be lying with the armpit underneath the bolster. In some instances, it might be indicated to have a lower position. And then also, as I mentioned, having a blanket or pillow under the head might be comfortable, but if you're okay without it, that's just fine too. You can use your head as a prop. So the first step is to get into this position and begin your breathing practice. So a nice big full expansive in-breath, stretching your rib cage and impacting your alignment of your spine from the inside of the body, but without causing strain. And then relaxing all the way on the exhale. And finding a full expansive in-breath. Not only breathing into the top ribs, which it feels more accessible for most people, but also the bottom ribs, feeling the breath circumferentially around the entire rib cage. So this is how I'll start most patients for a week or a few weeks. And then the progression, when you're ready to go for the next step, would be to inhale the arm reaching overhead. And exhale, returning it back. And inhale the top arm overhead, thumb points down. Maybe the thumb rests on the floor. Maybe it doesn't quite reach and you prop up on a block or on a pillow. And then you might stay here and just breathe and enjoy the stretch in the side body. And you would work with this for a week or two. And then extending the top leg is the next step, pressing out through the heel, letting the inside of the foot touch the floor. So you have this nice long side body reach happening. Some people, I describe this as the banana pose, laying over your bolster. And again, breathing into the top ribs and the bottom ribs. And staying here for 10 or so breaths. And then when you're ready to come out, bending the elbow, bending the leg, returning the feet stacked on each other, and then slowly pressing up to an upright position. And I'm just going to briefly demonstrate how this works just the same with, instead of the bolster, two folded blankets stacked on top of each other. So you lie, this time I'll demonstrate with my right side down, lie over the stack, either with your pillow or with a prop of your arm. And here's where you start, just breathing, exploring space in the side body and the rib cage, feeling your breath all the way into the pelvis. And relaxing completely as you exhale. And then stepping it to the next phase, depending on how long you've been practicing this position. And really emphasizing the breathing, because that's what can mobilize your tissues from the inside out. So your in-breath is going to really expand and broaden the space between your ribs, between your bones of your spine, and the exhale lets things kind of soften and relax into their newfound position or availability of tissue positioning. So I hope this is helpful to you, and if you have questions, as always, feel free to reach out in a charm message or by leaving a message for me at the office. Be well.